Lady Hazelwood, I believe you are carrying that. And you have a motion and a second.
Thank you, Mr. Chairman, and we do have an amendment on this bill.
Okay. Is it 6424? Is that correct?
That's correct.
Okay. Got a motion, a second on that. Without objection, let's go ahead and get that on the bill so we can discuss that. So without objection, all those in favor of Amendment 6424, say aye. Opposed? Ayes have it. We are back on the bill as amended. You are recognized.
Thank you, Mr. Chairman. This bill will reduce the total number of private beds that are in intermediate care facilities for individuals with intellectual disabilities available in Tennessee upon the voluntary surrender of the certified certificate of need, the CON, for such beds by the owner. What we're trying to do in Tennessee is to make sure that people with developmental disabilities have the best chance that they can have to be integrated into the community. Sometimes these people choose to be in group home situations, and we have some larger providers in the state, like my own Orange Grove, that would continue to provide these kinds of beds. So this bill puts a floor on the number of beds that would be available, so that we still allow people, we have enough beds to allow people the option to choose. It also makes sure that our folks in the department, when they're discussing options with patients and their families, they give them an even-handed perspective of what the pros and the cons are for the different kinds of facilities or in-home care that might be available. So with that, Mr. Chairman, I would ask for your consideration.
All right, thank you. And did you have somebody here that was going to testify
I have somebody
if available?
if there are difficult questions, then we have people here to testify.
All right. Are there any questions for the sponsor of the bill? Okay. Seeing none, let's go ahead and vote on House Bill 315 as amended. All those in favor say aye. Aye. Opposed? Ayes have it. Bill goes on to calendar and rules.
Thank you very much.
All right, thank you. That brings us to item number 2, House Bill 1358. Chairman Farmer, you are recognized.
Thank you, Mr. Chair. And I do have an amendment there,
Okay, let's get
3751.
a motion second on the bill. Okay, and you have an amendment 3751, is that correct?
That is.
You have a motion second on the amendment. So that rewrites the bill. So without objection, let's go ahead and vote on amendment 3751. All those in favor say aye.
Aye.
Opposed? Ayes have it. We are back on the bill as amended. You are recognized.
Thank you, Mr. Chair. This was brought to me by a constituent urging us to urge the United States Department of Health to test for metachromatic leukodystrophy, MLD. It's a rare genetic brain disease that can be tested for, I guess, when a child's born on that initial panel of tests by just a sample of the blood test by a prick. So that's just what this does. So,
All right. Do we have any questions for the sponsor of the bill? Okay. Seeing none, we are voting on House Bill 1358 as amended. All those in favor say aye. Aye. Opposed? Ayes have it. Bill goes on to calendar and rules. All right. That brings us up to item number 3, House Bill 469. Chairman Crawford, you have a motion, a second?
Thank you, sir. Thank you, committee. I had some people that were coming to speak today, and I asked them if they would just not do that. We don't want to waste the committee's time. I do want to take 1 second and talk about this bill as far as what it means to my community. This is a young man who has basically an autism that he forgets how to swallow, and he can't eat, and they have to feed him through a feeding tube. And they were having a hard time finding a physician that could treat him in the state of Tennessee. They did find one in the University of Virginia. And so my constituent's having to drive across the state line once a week when he has his therapy. And that's what this bill is trying to fix. I do want to take a few minutes and thank TMA for working with me, the Department of Health. We've got this bill in a pretty good spot, but we think we can make it better and not just help one person, but help several people in the state of Tennessee. So if you would be courteous enough to allow me, I'd like to roll this to the first calendar of next year.
Thank you. And without objection, can we do second calendar of next year? Our first calendar is usually,
So
Well,
you're the
that's-
chairman. I
actually,
can do.
I
you
take that
do
back. Our first
anything?
meeting actually usually does not have a calendar, does it? No. We're good. We're good. First calendar next year without objection.
Thank you, sir.
House Bill 469 without objection was first calendar of full health of 2024. That brings us to item number 4. Chair Lady Moody on House Bill 634. You are recognized. You have a motion and a second.
Thank you. I've already been in this room for 2 hours, so I was just comfortable again. Thank you so much, Chairman and committee. What this bill does, this is part of Senator Hale's Children and Families package. And what this bill will do, it will create the Child Care Improvement Fund, which will be administered by the Department of Human Services. I'll take any questions.
Do we have questions for the sponsor of the bill? Okay. Seeing none, we will be voting on House Bill 634. All those in favor say aye. Opposed? Ayes have it. Bill goes on to Finance, Ways and Means.
Thank you, Chairman and Mr. Chairman and committee.
All right, that brings us to item number 5, House Bill 952. Chairman Boyd, you are recognized. You have a motion and a second.
Thank you, Mr. Chairman and committee. And Mr. Chairman, I do have an amendment.
All right, thank you. And I believe there are 2 amendments. Is that correct?
Let me see here, Mr. Chairman. I apologize. I thought we had roped it into one, Mr. Chairman, but I'm showing drafting code
We got 5506.
5864.
Okay, that one just, I think rewrites just one section, but I think we have,
How about 5507, Mr. Chairman?
okay, that's our first one that we need to put
Okay.
on. Okay. All right, got a motion, a second on that. Okay, without objection, let's put on 5507. All those in favor say aye. Aye. Opposed? Ayes have it. And then we have an amendment to the amendment. Is that correct? Drafting code 5864. Is that correct?
Yeah, that's right, Mr. Chairman, 5864.
All right, without objection, let's vote on amendment 5864. All those in favor say aye. Aye. Opposed? Ayes have it. Okay, we're on the bill as amended. You're recognized.
Thank you, Mr. Chairman, and I appreciate the help on those amendments there. Sometimes it gets confusing, but Mr. Chairman and committee, in 2019, the Certificate of Need Reform Working Group was formed, and they have been meeting and making various recommendations over the last few years for reform to the program in ways that are both strategic and methodical to reduce disruption to the industry and to the service that patients in Tennessee receive. And so this bill, I know sometimes when we say certificate of need, people think it does a lot. This bill is actually pretty simple, members. It simply consolidates the Certificate of Need Board and the Licensing Board to create a new 15-member board that would be called the Health Facilities Commission. And this will go into effect on July the 1st of 2024. And it will oversee both the CON program and the licensure and regulation program. Mr. Chairman, I'll take any questions.
Do you have any questions for the sponsor of the bill? Okay. Oh, Chairman Clemens, you are recognized.
Don't we already have a health facilities commission or something along those lines? That's regulating current facilities at this moment and appears to be issuing immediate jeopardy orders at a pretty regular clip. Or maybe name something else.
I think,
You're recognized.
Mr. Chairman, you may be thinking of something else. Right now, this is a new entity that's being formed. It's when you consolidate these two boards together, it's a new one. There may be something with the word facilities in it. I think I know what you're talking about, but it is not this commission.
Okay, thank you, Mr. Mayor.
Any further questions for the sponsor of the bill? All right, seeing none, we are voting to send House Bill 952 to Government Operations. All those in favor say aye. Aye. Opposed? Ayes have it. Bill moves on to GovOps. that brings us to item number 6, House Bill 1095. Chairman Boyd, you are recognized. You have a motion and second.
Thank you, Mr. Chairman and committee, and I do have an amendment, and I'm positive about the drafting code on this one. It is 4871.
All right. You have a motion and second on the amendment. So without objection, let's go ahead and vote on Amendment 4871. All those in favor say aye. Opposed, ayes have it. We are back on the bill as amended. You are recognized.
Thank you, Mr. Chairman. So in 2022, I passed a piece of legislation to do a study on the cost and the usage of temporary staffing agencies in long-term care facilities in Tennessee. And the results of that told us that nursing homes spent in 2019 about $10 million on temporary staffing. And by the year 2022, it was $100 million for temporary staffing. Assisted living facilities went from 170,000 to 4 million just in that 3-year period. And so what we've decided to do and what this bill would do is it would require those staffing agencies to meet the same requirements that the nursing homes and the long-term care facilities meet. So they would be held to the same standards. They would require these staffing agencies to register with the newly created Health Facilities Commission that I just talked about. It would require that the CNAs provided by the staffing agency would have to meet all the same licensing, certification, training, continuing ed requirements. They would also have to have a federal background check, make sure the worker's name doesn't appear on the sex offender registry list or ineligible persons registry. It would require them to maintain workers' compensation insurance, liability insurance, and keep the records for 5 years, and a variety of other things that are common for assisted living facilities. So, Mr. Chairman, I could go into more detail, but that's essentially what the bill does. Mr. Chairman, I'll take any questions.
Okay. Any questions? Chairman Clemens, you're recognized.
Mr. Chairman, do you mind if I ask legal a question real quick?
Sure. Without objection, we will go out of session to hear from legal. Okay, Chairman Clemens, you're recognized.
Yeah, what's the Health Facilities Commission? There's something of that name already in the code book. What's the difference here?
Matt King, Committee Counsel. Yes, the Health Facilities Commission was formerly the Health Services and Development Agency. It was renamed a couple of years ago. In one of the recent pieces of legislation in the past 2 years, the Board for Licensing Healthcare Facilities was taken from the Department of Health and moved underneath the Health Facilities Commission, formerly HSDA. The bill that was previously considered merged the two boards. The two boards had not been previously merged. They remained separate board entities. That bill merges the memberships of the two boards into one, so that now the Health Facilities Commission and the Board for Licensing and Healthcare Facilities are essentially going to be merged in terms of their board membership. But yes, the Health Facilities Commission is in charge of certificates of need and also now oversees licensing of healthcare facilities now that it is over the Board for Licensing and Healthcare Facilities. That was done in last year's bill.
Thank you.
You're recognized.
Thank you, Mr. Chairman. And so both of those have different directors, am I correct? Are we changing who's going to be the director of those facilities? 'Cause I got some concerns about the Healthcare Licensing Facilities Commission director.
The Health Facilities Commission has one executive director that is now over all of that.
So even though we're merging those two, they're just going to have the same director who's over the licensing facilities?
The executive director for the Health Facilities Commission would oversee the activities of the Board for Licensing, yes, and those licensing activities, as well as the certificate of need portion of that.
So we'd be expanding their jurisdiction and power with that.
It more or less was expanded last year with last year's bill by moving the board underneath them, yes.
Okay, thank you.
Thank you. Without objection, we will go back into session. Chairman Boyd, do you have any further questions? Okay. Any further questions for the sponsor of the bill? Okay. Question's been called. We are voting on House Bill 1095 as amended. All those in favor say aye. Aye. Opposed? Ayes have it. Bill goes on to Finance, Ways and Means. right, that brings us to item number 7, House Bill 1194. Chairman Williams, you are recognized. You have a motion and a second.
Thank you, Mr. Chairman. And just for clarification purposes, traveling from subcommittee is amendment drafting code 5211.
You have a motion and a second on Amendment 5211. Since that rewrites the bill, if there's no objection, let's go ahead and put that on the bill. All those in favor of Amendment 5211, say aye. Aye. Opposed? Ayes have it. We are back on the bill as amended. You are recognized.
Thank you, Chairman and members. Last year, the Tennessee General Assembly passed the Colonel Thomas Bowden Memorial Act, which created a 3-year pilot program for respite care for unpaid caregivers for those family members who are caring for their loved ones in their homes. Currently, 120,000 Tennesseans are living with Alzheimer's or dementia. And what this bill would do, it would make a few changes to the existing statute to allow for more people to be able to participate. What we found since June at its enactment date, what we found is that a lot of respite care facilities were busy with other citizens in the state. And so what these few changes would provide specific examples of what coverages were to be able to, and clarifies that this original pilot was for 225 people, and extends the pilot for another few months to allow for a true 3-year pilot because the implementation took a little bit longer than we expected. Happy to answer any that's what the amendment does. I'm happy to answer any questions the members might have.
Representative Hakeem, you're recognized.
Thank you, Mr. Chairman. Representative, is that number still at 225 or does it expand?
You're recognized.
Yes, the number was originally set at 225 last year in the original amendment. What this does is it clarifies that those services are for the same 225 over the 3-year period.
Okay.
Mhm.
All right. And do we have the 225? I'm sorry.
You're recognized.
Do we have 225 participating in the program at this point?
Currently, we have just over 50 people that are participating, and that's the impetus behind the extension and the minor changes we're making today, trying to create a pathway for more people to participate.
Thank you, Mr. Chairman and Representative.
All right. All right. Any further questions for the sponsor of the bill? All right. Seeing none, okay, we are voting on House Bill 1194 as amended. All those in favor say aye. Aye. Opposed? Ayes have it. Bill goes on to calendar and rules. That brings us to item number 8, House Bill 496. Representative Martin, you are recognized. You have a motion and a second.
Thank you, Chairman and committee. I also have an amendment traveling with it.
Okay, 5564,
Yes,
and it
sir.
rewrites the bill.
Yes, sir.
Okay, you have motion second on the amendment. Without objections, go ahead and vote on Amendment 5564. All those in favor say aye. Aye. Opposed? Ayes have it. We're back on the bills amended. You are recognized.
Thank you, sir. Current laws has no statutory time frame for licensure boards to get licensed to individuals. So what this does would set a 60-day time frame for the department to make a decision on the licensure of those applicants. This would speed up the process and help get people into the workforce quicker here in Tennessee. This legislation was supported by the impacted professionals, and language was worked out with the Department of Health in the process. I stand ready for question and
Right.
humbly ask for support.
All right, Representative King, you're recognized.
Thank you, Mr. Chairman. Mr. Representative, is there a penalty or a method of encouragement to that board to adhere to the 60-day limit?
Representative Martin, you're recognized.
You speaking in regards to the Board of Health being held responsible if they don't get it within those 60 days? Is it?
I don't know if we would, I guess, what encourages them to comply with the 60 days? Is there a penalty of some type?
I'm not positive there would be a
Okay.
penalty. No, sir.
All right.
Would legal, there's not one stated in the bill. They're not. All right. Any further questions for the sponsor of the legislation? All right. Seeing none, we will be voting on House Bill 496 as amended. All those in favor say aye. Aye. Opposed? Ayes have it. Bill goes on to government operations.
Thank you, Chairman and committee.
Well, that concludes our calendar of the day. And so, again, if you are on Health Subcommittee, stick around. Immediately following this committee, we will begin with the bills that we did not conclude with yesterday in Health. So without objection, we are adjourned.